Getting lost in the hospital is the most frustrating part of seeing the doctor. Hey everyone, welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel, and today I want to talk about location. You know, they say it's the first rule of real estate, right? Location, location, location. And unfortunately, in healthcare, it is a primary factor for patient satisfaction and employee satisfaction, for that matter, to be able to experience across your health system location. You got to understand, health buildings are incredibly complex and large, and I should know. I spent 7+ years working as an emergency room technician on the front lines of a couple different emergency departments. And my job, part of my job at least, was to know where everything was in the hospital, because I would transport patients to places, I would get around to go visit different units or things, or I'd have to help other folks get to where they needed to go. And so you get to know a lot of where things are in a hospital. Now, I had the benefit of working, 3 to 4 shifts per week, 12-hour shifts. So I spent a lot of hours in that building. Most of our patients do not spend that many hours in their building. And even the folks that did work a long time or had spent a lot of hours in that building or working at that hospital, they still didn't really know their way around as well, because they would, walk in their favorite entrance and go to their unit or where they worked, and they would begin their job and begin their shift and never had to really worry about it. But these buildings are complex. They're labyrinthine at times. Like, you get down into the basement where the cafeteria is, or where biomedicine is, or where linen service is, or all the different places that are usually in the basement of a hospital. Fortunately, IT is typically moved out of the basement up a little bit, so they get a little bit more visibility and a little bit more credibility from the organization. They have a little better office space now. But the areas that you need to get to and navigate are difficult. How do you get around? Now imagine you're a patient trying to find the doctor's office in a new hospital building. You don't know where to park. You don't know where to go. You don't know how to get, which door to get in. You don't know to turn left, to turn right. Signage, there are so many different places in a hospital. The signage is just confusing. Am I looking for the west entrance? I don't know. We have to enable location. We've got to be able to give our end users a digital way to navigate the hospital, to get around. So a patient knows where to park, what door to walk in, how to navigate from that door to their doctor's office. And then heck, the location can be smart enough to know, the building can be smart enough to know that this person just walked in, and then trigger a cascade of activities, whether it's a new privacy form or an updating of insurance or notifying the team and checking that patient in for their appointment. We've got to start using location context to help deliver better outcomes in healthcare. Another of my jobs was we would run out of certain tools that would be used in the emergency department at times. And one of them primarily would be an IV pump. And a lot of times they'll use an IV pump to deliver a regulated and metered dose of medicine to a patient. And it goes over time, sometimes multiple hours, depending on a whole wide variety of factors. But I would transport that IV pump with the patient to their admitted floor. So they would go up to one of the admission units, whether it's medical, surgical, ICU, in fact, med surgical ICU, you name it, a lot of different units. But you go up there, and instead of turning off the IV pump, you would just give them that pump. And then sometimes, if you weren't doing your job right, you would return empty-handed. But what part of my job was to be able to go and replenish our department with IV pumps. And we didn't have a good system, with biomedicine or par leveling to replenish our IV pumps. So sometimes in the middle of the night when we were running low on IV pumps, I would just take a spare IV pole, one of those poles you see people walking around with in the hospital, and I would take it up to one of the medical surgical units, and I would find the secret stash, the closet or the corner where they had tucked all of their IV pumps, and I would just start taking them. And then I'd walk by the nurse's station and I'd wave at them, and they kind of gave me a really dirty look, but we were in the ER, man. We thought we were the cat's meow. Our needs are most important. And so we would just take it. And the other thing with location is, do you know where your things are? And how do you know where your things are? Would it help to know how many IV pumps were supposed to be in the CV ICU, or how many IV pumps were supposed to be, how many of this measuring device or ultrasound machine or point of care testing? Where are your things? How do you know where they are? And can you help use location to help with inventory control? Man, this would save so much time. In fact, they estimated it would save almost an hour's worth of a nurse's time per shift if they just knew where to find things, if they had the tools that they needed. And so this is a very practical way to make the lives of our caregivers better, that they would actually have. So they get an order for an IV drip of something, the pharmacy delivers the medicine, and they have an IV pump that they know where to get it. They can turn it on, plug it in, deliver the medicine to the patient, and get about the rest of their day. We've got to use location effectively. It is a fairly simple tool to turn on at times, and it needs to be done. The problem is the complexity of healthcare organizations. There are so many different people who touch a project like that. All of them have their different concerns or ideas or things that they care about specifically, and they all have to be brought to the table, and all of them are valid and have to be accounted for. And so it's not just as simple as, oh, let's just turn on location. We've also got to understand the whole perspective of how a patient interacts, not just with our building, but with our health system in general. So hey, get to know where you're at, turn on location, deliver a better patient experience so that no family is ever left wandering the halls with that look in their eyes of, how do I get there again? We can help them with that. Let me know what you think. Have you ever had a frustrating experience trying to navigate your way through a hospital building? Even if you've worked in that building for years, you may have had challenges figuring out where to go or how to get there. So time for location to do its work. Let me know your comments, concerns, challenges, or critiques, and I'll see you tomorrow.